what I'm gonna do is you've seen the deflated balloon, how it looks, it's like a multivitamin. I'm gonna put this at the back of your throat and you have a glass of water in your hand. And once I put it inside, you just start swallowing, and then the whole thing is gonna go inside all the way in. I'm gonna take an X-ray, make sure it's in place. Then we're gonna start inserting 550 cc's of saline water, and then we'll take another X-ray to make sure it's in place, and then we take the tube out, and that's it. Voila. Yeah?
Very excited.
Very exciting indeed.
Yeah.
Excellent. Are you ready?
Yes,
Just take that with your hand, and then I'm gonna ask you to open wide, and I'm gonna put this at the back of your throat, okay? And if you feel like you're gonna vomit, don't worry, just keep drinking, okay? And that's it, and that's it. And drink. Drink, keep drinking. Perfect. Keep drinking. That's it. It's in. Excellent, well done. We're gonna go now for the X-ray.
Okay.
Brilliant, if you can stand up with me, please. Just come over here, put your back here. Put your back here, and with your left hand, hold this please. That's it, right? Okay, Hammeed, X-ray showed that it's perfect, it's in place. What I'm going to do now is I'm going to start putting the 550 cc's of saline, all right? You will feel like some cold fluid going inside, as if you're drinking but you're not drinking. This will take about 5 minutes.
And that will go in.
Yeah. Okay, Hammeed, we took the X-ray, it's in place, everything looks perfect. What I'm going to do now is to take the tube out, okay? You'll feel a little bit of give, but that's it. Also resist any tendency to vomit, yeah? Just for like 10 seconds until I take it out. Brilliant. Resist that. Yeah, that's it, all done. Fantastic. Congratulations. That's brilliant.
That's amazing, yeah.
You're gonna now speak to my dietitian. She's gonna take you through everything, your diet, and she's gonna give you the scale and everything, yeah? Fantastic.